UDPGT is completely absent. Please keep that in mind. In Crigler-Najjar type 1, UGT is completely absent. That's why bilirubin level may go up to as high as 40 milligram per DL. Usually the baby dies within 15 to 21 days. Within 3 weeks, the baby succumbs because there is carnicterous hepatic encephalopathy and the baby dies. But for Crigler-Najjar type 2, there is the same thing which is happening for Gilbert. Suppose I need 10, I have 8, I have Gilbert. But in case of Crigler-Najjar, I have 4. So you can see significantly increased level of bilirubin. Usually it varies between 15 to 20, but a considerable amount of life expectancy, but it is hampered. For Gilbert syndrome, there is no problem with life expectancy because a completely a normal healthy individual. For Crigler-Najjar type 1, bilirubin may go up to 40 mg per dl and the patient will die because of hepatic encephalopathy. For CNS type 2, you will see the bilirubin invariably between 15 to 25. Okay, so that's how the pattern varies, and you all know that after conjugation, the bilirubin certain part urobilinogen is there, which comes out with urine. Then there is starcobilinogen. Okay, and that gives color to the fecal matter. So we all know that. Now that's the specific thing. Now is there any other causes of jaundice? Of course we do, like ABO incompatibility, RH incompatibility, glucose 6 phosphate dehydrogenase deficiency. Now, can you tell me ABO incompatibility, glucose 6 phosphate dehydrogenase deficiency, and RH incompatibility? Is it a pre-hepatic cause, hepatic cause, or post-hepatic cause of jaundice? Anyone?
It's a
Pre-hepatic.
pre-hepatic cause.
Very good.
Pre-hepatic
So
cause.
these are pre-hepatic causes. Now, what about the other four? Like CNS type 1, type 2, Dubin Johnson, Gilbert, and Rotor. What is that?
Hepatic cause.
Intrahepatic.
Very good.
Hepatic.
Intrahepatic or hepatic cause. Good. Now let's see certain causes. We know that, right? Hemolytic anemia. We have already seen that. Immune mediated primary or secondary FIV neoplasia FALV. They are the some of the causes, but not that important. Next comes non-immune mediated infectious diseases. Okay, Haines body anemia, hypophosphatemia, hereditary defects like G6PD or other protein deficiency. They are there. Now coming to hepatic disorder. In hepatic disorder, we have inflammatory hepatic, that is the neutrophilic cholangitis, lymphocytic cholangitis, hepatic lipodosis, feline infectious peritonitis, amyloidosis, sepsis, hepatotoxicity due to drugs. Then there are viral hepatitis. We cannot ignore that, right? Now, coming to post hepatic disorder, we know that pancreatitis, cholecystitis, cholelithiasis, most commonly associated with neutrophilic cholangitis, hepatobiliary mass, that is any space occupying lesion, so most likely malignancy, and then there are duodenal masses that may also obstruct the CBD to give rise to post hepatic jaundice. Right. Now, if you look at the picture on the right hand side, that's how a normal hepatocyte looks. That we have seen in our anatomy book, right? Histopathology actually. Now, during viral hepatitis, there are three classic changes. Questions usually come from there. Ballooning degeneration. Just look at this ballooning of the cells. Okay, this is called ballooning degeneration, along with bridging necrosis. Ground glass opacity. These are the ground glass appearance. You can see as if some sort of friction is there. And this one is Councilman body. Just look at the follow the arrow. Councilman body. Councilman body is pathognomonic of acute viral hepatitis. Okay, so Councilman body is pathognomonic of acute viral hepatitis. Now, if you get a question like this, which of the following is pathognomonic of acute viral hepatitis? Then there is ballooning degeneration, bridging necrosis, ground glass hepatocyte, Councilman body. Councilman body will be your answer. Definitely, no other second thought. Okay. If you get a question like this, which one of the following changes are seen during hepatitis? Ballooning degeneration, ground glass hepatocyte, Councilman body, all of the above. All of the above will be your answer. Okay. Now, ballooning degeneration for viral hepatitis, ground glass opacity, more specific for hepatic B virus, and Councilman body, more specific for acute hepatitis, not for chronic. So, hepatitis A and E. Okay. So that's how we can differentiate these things. Now, this is the comparison of these five hepatitis viruses. If you look at it, hepatitis A virus, which is a pico RNA virus, okay, hepatitis B virus, DNA virus, because the DNA is in the core, hepatitis C virus. Again, I am requesting everyone, please try to join within the time, because you guys are well off about the timing of the class. So, like someone is joining at 7:10, 7:15, it somehow breaks the rhythm of the class. So kindly try to join within the time. That's better for you as well. So now coming to hepatitis C virus, this is flavivirus. Hepatitis D, D for Delta. Hepatitis E, Hepi virus. Hep E, hepatitis E. Okay. So the five hepatitis viruses, let's look at the genome. Viral genome. For hepatitis A, we have ssRNA. For hepatitis B, we have double stranded DNA, the only DNA virus in the chart. That's why it's easy to rule out. All of the following are RNA viruses except HIV, HBV, HCV, HDV. So HBV will be your answer. Hepatitis C virus, ssRNA. Hepatitis D virus, ssRNA incomplete RNA. And hepatitis E virus, ssRNA. Now, transmission, hepatitis A and hepatitis E will know that it is associated with hygiene. So, fecal-oral transmission is there, right? Now, on the other hand, hepatitis B, C, and D, for them, parenteral transmission is there. That is through body fluids to sexual contacts and all. Okay. Now coming to incubation period, very very important, because from microbiology perspective, this chart is actually contains in every line there are MCQ, like 5 6 different patterns. One can come from family of the virus, one can come from viral genome, one can come from route of transmission, one can come from incubation period, and the last one, chronicity. So the thing is, incubation period for hepatitis A virus, it is from 1 week to through a month, 1 week to 1 month. You can remember like that, or 15 to 45 days. For hepatitis B virus, you can remember the data, or 6 weeks to 6 months for easy remembrance. Okay. For hepatitis C, 15 to 150 days, and for hepatitis D, usually a month to 2 months. Hepatitis E, also similar to hepatitis A. Both of them are fecal-oral route infection takes place, and usually there is due to contaminated water consumption. Okay, now that's how we can differentiate. Now coming to chronicity. For chronicity, you can remember one thing: hepatitis C, C for chronic. Highest chance of chronicity is associated with hepatitis C. It is easy to remember, C for chronic. Like hepatitis D, delta virus. Like C, it's a chronic. Now, what else can cause chronic? Obviously, hepatitis B. And for hepatitis D in most of the cases, more than 80 90% cases, it's a super infection. Because it has an incomplete defective RNA, it cannot cause infections in it. Okay, that's why there is chance of superinfection or co-infection. I hope you get that. Now from this up to this section, do any one of you have any doubt? Anybody? Please feel free to ask. Don't think like it's a demo class. Maybe some of you will not join, some of you will join. Those who are planning to join, we will have a detailed discussion on this topic. So that's why I'm requesting all of you. If you have any doubt, you can ask me. So anyone? Okay. So none of you have any doubt. Again, I would like to give you like a short description about this table. This section deals with the basic pattern of the viruses which can cause hepatitis. There are 5 types, though some new types are coming up, but for MCQ perspective, they are not really important. Okay, so for you, from exam perspective, that's all you need. Hepatitis A is there, B is there, C and D. Among them, A and E, fecal route, rest, blood-borne parenteral route, that have understood. Now, hepatitis B, the only one to have dsDNA, rest as single-stranded RNA virus. All are complete except D. D is defective. D for delta, D for defective. A and E can cause acute infection. Rest of them can cause chronic infection. Highest level of chronicity, hepatitis C, C for chronic. Now coming to incubation period, shortest incubation period obviously for the acute one, so A and E, from 10 days to 50 days, like that, or from 1 week to 1.5 months or 2 months. That's how you can remember. Okay, for hepatitis B, longest period of incubation period 6 weeks to 6 months. Okay, for hepatitis C, more chance of chronicity. For hepatitis D, cannot cause infection alone because the RNA is defective. It needs somebody's help. Mostly it comes by hepatitis B virus. So those people who are suffering from hepatitis B infection already, they are more prone to develop hepatitis D superinfection. So anyone, any doubt?
No, sir.
Okay. Now going to the next part. Hepatitis A and hepatitis E. Again, another correlation because they are most frequently caused viral hepatitis. Okay. So these viruses are responsible for viral hepatitis. Well, I don't know whether all of you, like many of you may have been suffered from jaundice. Many of you may not, or many of you have seen some of your near and dear ones suffering from viral hepatitis. Likely it is A or E. Okay, so both of them are non-enveloped icosahedral shape with a positive